Did you know that thousands of years before modern medicine existed, the ancient Egyptians were already performing surgery? Yes, over 3,000 years ago, they carried out operations on the human body. But how was that even possible? There were no advanced tools, no anesthesia, no hospitals. So, how did they manage to save lives, not destroy them? Let's travel back in time to one of the most mysterious civilizations in human history, ancient Egypt. The story of Egyptian medicine began around 2600 BC. That's nearly 4,600 years ago, even before the birth of Jesus Christ. Back then, most of the world had no idea what medicine even was, but the Egyptians were already experimenting with surgery and healing. Their doctors were not just physicians. They were priests, scientists, and magicians all at once. They believed illness was caused by evil spirits or divine punishment. So, their healing process combined science, prayer, and ritual. Historians have found an ancient medical text called the Ib, containing over 800 prescriptions and surgical techniques. It explains how to clean wounds, stop bleeding, and even how to stitch the skin after an operation. At the Cairo Museum, scientists discovered mummies with skulls that had been cut and bones that were surgically repaired. Some even had metal fillings in their teeth. This means the Egyptians didn't just mummify the dead, they also operated on the living. One name stands out: Imhotep, often called the world's first surgeon. He was Pharaoh Djoser's royal physician, and was later worshipped as the god of healing. His temples served as early hospitals, where medicine and religion came together. But what kind of tools did they use? Surprisingly, archaeologists have uncovered ancient bronze scalpels, hooks, scissors, and even tiny saws. Using these instruments, they performed a rare operation known as trepanation, drilling a hole in the skull to relieve pressure or treat head injuries. And here's the shocking part: many skulls show signs of healing, which means the patients survived those surgeries. So, how did they deal with pain? There were no injections or anesthesia in those days. They used natural sedatives like mandrake, hemlock, and opium extracts to make patients sleep or feel numb. To stop bleeding, they applied honey and resin, which worked as powerful natural antibiotics. They also created healing oils and herbal wines, the earliest forms of today's antiseptics and medicines. During the process of mummification, Egyptian embalmers learned about the human body in great detail. They studied each organ, the brain, the heart, the liver, and developed an understanding of human anatomy thousands of years before modern science did. In some mummies, scientists even found prosthetic limbs, like artificial toes or metal teeth, the oldest examples of prosthetic surgery in history. But one question still remains: how could they perform such advanced operations without microscopes, x-rays, or medical equipment? Some believe they had incredible practical knowledge, while others think their skills came from divine or mysterious sources. Perhaps it was science, or perhaps something we still can't explain. Even today, modern scientists are amazed by the brilliance of ancient Egyptian medicine. Their writings, tools, and surgical techniques prove that human intelligence has always been capable of greatness. Was it pure science, or the lost wisdom of the gods? Tell us what you think in the comments below, and don't forget to subscribe for more secrets of the earth.